We're going to be talking about initial epistaxis management. So the first thing that you're going to want to do is just do a general assessment of the patient. One of the most important things with epistaxis obviously is making sure that the patient is safe. So you want to get a sense for the patient, what's their mental status, are they alert, awake, able to lean forward and protect their airway. A lot of bleeding can end up going back into the pharynx, being swallowed by the patient, causing nausea and vomiting, but they can also form a large occlusive clot in the nasopharynx that can become an airway risk. So when you first are assessing a patient, it is always a good idea to take a look in the mouth, to look in the oropharynx and see if there's a large clot hanging out down there. In which case, expediting the escalation to get the team involved will be important. It's also important to try and determine what side the bleed is going to be coming from. That's not always obvious, but it's helpful if you can figure that out. Most nosebleeds, almost all of them, are going to come from the front of the nose. So the initial steps in management are trying to apply pressure where the blood vessels will typically be bleeding, which will be the anterior part of the nasal septum. Up top are your nasal bones, so you're not going to be able to apply pressure in that region. You really have to kind of get down closer to the nostril and apply pressure there for a good solid 15 minutes at least. A good idea initially is to place a cotton ball soaked in Afrin in the front part of the nose on the side that it's bleeding from, or if you can't tell, placing a cotton ball on both sides and then applying direct hard pressure. Again, I know it's difficult to hang around for 15 minutes when you have other patient care responsibilities. That's why it can be helpful to fashion sort of a makeshift splint. You can use 2 tongue depressors, tape them together in a way that you can clip the front part of the nose and apply pressure. Leaving that on for a good 15 minutes. If these initial measures are unsuccessful, at that point it's a good idea both to contact your primary team but also to get ENT involved.